How to make the 3D printed medical models. Medical models in 7 steps. Acquire patient-specific medical images, MRI, CT, ultrasound, etc., in digital imaging and communication in medicine, DICOM, standard format. Process the DICOM images using a combination of software and human expertise to define the anatomy of interest and generate a 3D file. Secure approval of 3D file from a certified professional and generate a 3D printable file called an STL. Process the STL file for printing, including generating support structures. Print the 3D file in-house or send to a third-party printing service. Post-process the print, if printing in-house, to remove supports, polish, label, etc. Provide to surgeon, patient, doctor or medical student.